Dr. Lee Kroll is a pharmacist and adjunct professor at the University of Iowa. She is the author of multiple papers on chronic and acute pain management and spoke at a sports medicine conference I attended last winter. Consequently, I chose to interview Dr. Kroll in an effort to answer the question, do non-steroidal anti-inflammatories offer any prophylactic benefit prior to a hard practice or competition? If so, are they safe? Headlines suggest that this is not a new question and that a simple answer may be difficult to find. After digging into the research to prepare for our conversation, I developed a greater understanding for how ibuprofen works in the body. For example, ibuprofen can relieve pain, but there's a question as to whether or not that pain is the result of acute muscle damage or degeneration over time. Additionally, we need to remember that ibuprofen pain relief is the result of treating the symptom. It relieves the pain, it does not treat the cause. Again, it is not a curative approach, it simply treats the symptom. There is still some debate among research communities as to whether or not ibuprofen is useful in treating athletic injuries. Some studies suggest that prophylactic use of ibuprofen does result in decreased inflammation, lower creatine kinase levels, and less muscle soreness, while other studies report that there is no benefit of prophylactic use of ibuprofen. Researchers do seem to agree that ibuprofen does increase the permeability of gastrointestinal lining. It does inhibit the inflammatory response, which can result in impaired tissue and muscle damage. It also inhibits COX isoenzymes and prostaglandin synthesis. COX isoenzymes play a role in tissue synthesis following mechanical loading. Prostaglandin synthesis is associated with tissue metabolism, and both play a role in the growth and strength of the extracellular matrix. In other words, play a role in adding strength to musculoskeletal tissues. With this information in mind, I asked Dr. Kroll the following questions. Some studies estimate that up to 30 to 50% of athletes take nonsteroidal anti-inflammatory drugs, including ibuprofen. From what I've seen in the high school setting, it seems common for these athletes to take more than the recommended dose, thinking that if 2 are good, 4 must be better, particularly if these athletes are running longer distances or have greater body mass. Is there any truth to this? Dr. Kroll said, sure. The placebo effect is huge. Therefore, if a person thinks they'll feel better taking twice the recommended dose, they probably will. At least 30% of the time, the research says that they will feel better. However, the risks of this overdosing are harder to pin down. Studies like this do not often get approved by IRB. However, she said it does appear that there's not a lot, it's a limited benefit to taking more ibuprofen than is recommended. Dr. Kroll also suggested that it really is likely that the number of athletes using ibuprofen is greatly underreported in the literature. Given that underreporting, I asked, is it enough to ask an injured athlete if they took ibuprofen prior to the game, or should that question cover more time? For example, should I be asking if the athlete has taken ibuprofen in the past 3 days? Dr. Kroll pointed out that the half-life of ibuprofen is only about 8 hours. So multiple days of ibuprofen use is maybe not as concerning in the immediate question as whether or not they'd taken ibuprofen within the last 8 hours. While athletes do seem to use ibuprofen to reduce or prevent pain, the evidence seems to suggest that ibuprofen use may impair the ability of muscle and tendons to adapt to the demands of exercise, suggesting a negative impact on performance. I asked Dr. Kroll how she recommends ibuprofen be utilized in the athletic population. Dr. Kroll's response indicated that taking an appropriate dose of ibuprofen after a hard practice may in fact decrease discomfort from delayed onset muscle soreness. She stressed that delayed onset muscle soreness is a metabolic response to anaerobic activity which cannot be prevented, but ibuprofen may reduce the pain related to delayed onset muscle soreness. We established that ibuprofen inhibits both COX isoenzymes and prostaglandins. Considering that these chemicals participate in the synthesis of the extracellular matrix that strengthens musculoskeletal tissues, Does ibuprofen minimize inflammatory pain and weaken extracellular matrix at equal rates? Or is there a dose at which injury risk becomes greater when using ibuprofen? It's kind of a tricky question, but Dr. Krall stated that musculoskeletal risk is likely dose and duration dependent. Occasional use of ibuprofen is likely no big deal, but there is an increased likelihood of injury with chronic use. She also reminded us that ibuprofen it masks the pain of inflammation, and the pain is the body's way of communicating damage or dysfunction. Masking that signal could also result in an increased risk of greater injury. Several sources talked about the risks of heart attack, stroke, and intestinal bleeding with long-term use of ibuprofen, but they did not define long-term. I asked Dr. Krall if there was a generally accepted definition of long-term and whether or not that definition varied with age. While Dr. Krall did not provide a definitive definition of long-term, she did note that most risks are likely minimized or minimal with occasional use of ibuprofen, particularly if the dose follows exercise as opposed to preceding exercise. We talked a bit more in depth about cardiovascular or cardiac reactions, and she noted that cardiac reactions have been seen following only a small dose or short duration. Long-term use is not required for these events. While the cardiac risks are lower, they are not obsolete in individuals without pre-existing conditions. For example, Dr. Krall pointed to headlines or reports of deaths in marathoners, ultramarathoners, etc. These athletes are in theory healthy individuals, no known conditions, no known risk factors for cardiac events, and yet they pass away early in the race, prior to rates of exhaustion. Dr. Krall wondered, so there are questions that have not been answered yet as to whether or not use of ibuprofen plays a role in these events. We do know that marathon runners, ultramarathoners, frequently use ibuprofen ahead of a race or ahead of a long training run. We just haven't yet figured out whether or not that use does in fact contribute to their death in these cardiac events. There's also evidence to suggest an increase in adverse reactions to ibuprofen when children are dehydrated due to fever or vomiting and diarrhea. I asked Dr. Krall if athletes who may be dehydrated but otherwise healthy are at greater risk. She responded that yes, anti-inflammatories do seem to convey renal risks similar to acute dehydration. So an example that she included was that following surgery, all patients who have been fasting since midnight or earlier are considered to be in a state of acute dehydration or to be pre-renal, showing early markers for renal failure and toxicity. She explained that ibuprofen prevents vasodilation, which is an intrinsic reaction that would allow greater or easier blood flow in a dehydrated state. She also noted that this tendency toward dehydration, or these risks that are associated with ibuprofen or dehydration, are also reversed quickly once the ibuprofen has left the body, has left the system. With a better understanding of the science regarding the use of ibuprofen, I asked Dr. Krall how she would talk to parents and coaches regarding the appropriate use of ibuprofen in an adolescent population. Dr. Krall stated that she would start first reminding parents and coaches that it's important to understand the goal of ibuprofen use, and to remember that pain is a signal. Masking that signal could lead to additional damage or injury. Additionally, she reminded us that the best approach to prevent significant pain or muscle damage, if that's one's goal, would be to change one's practice plan or approach to practice, emphasizing the importance of assigning appropriate training loads with consideration to the condition of the athlete. She also reminded us that while ibuprofen can aid in relieving pain from delayed onset muscle soreness, appropriate dosing of ibuprofen after activity is key. Again, short-term dosing can be useful, but chronic or prophylactic dosing of ibuprofen may carry greater risk than is necessary. After speaking with Dr. Krall, I believe it's fair to say that ibuprofen is often misunderstood by athletes and those who support them. This misunderstanding leads to misuse of ibuprofen. This misuse carries real risk of decreased performance, musculoskeletal injury, risk of cardiovascular events, or a pre-renal status, much like those who are dehydrated following medical procedures. To avoid these risks, athletes simply need to train smarter. by understanding pain as an informative signal and that inflammation has a real and beneficial role within the body, athletes may instead choose to seek other methods of pain relief, other methods of performance enhancement, such as sleeping an adequate number of hours, eating a balanced and adequate number of calories, balanced diet rather, and adequate calories, and maintaining hydration status throughout the day and during activity. These steps may lead to performance benefits and mitigate the risks of ibuprofen when not medically necessary. Thanks to Dr. Krall for her time. Thanks to you for your attention.